More medications, less health. Something's broken. Traditional medicine manages symptoms, but true healing addresses root cause. I'm Josh Rimini, pharmacist turned healer. At Beyond the Pills, we merge ancient wisdom with modern day science to inspire you through stories of transformation, practical trainings, and holistic healing. Join me and other practitioners as we guide you towards vibrant health, body, mind, and spirit, and move beyond symptom management into true healing. Welcome, everybody. Welcome to this episode of Beyond the Pills. I'm Josh Rimini, and today I have a very special guest, already a really good friend of mine. We have Rajat Chand. He's an MD. He's a board-certified radiologist who's based out of Austin, Texas, and he specializes in both adult and pediatric diagnosis and intervention. But why he's here today is he's served as an author and editor of multiple textbooks, as well as a speaker for international medical conferences on the topics related to both radiology and mindfulness. So Dr. Chand enjoys cooking, Brazilian jiu-jitsu, artistic exploration, and spending time with his pets. I love pet owners and lovers. He will be a lifelong student in yoga and aims to integrate Eastern spirituality, not only with his holistic view of healthcare, but also in teaching the future generations of physicians. Welcome, Rajat. What's up? How are you doing, buddy?
Thank you so much for that kind introduction, Josh. It's really wonderful to be here. I'm doing great. It's a beautiful Friday. I'm just making my way from Virginia to Texas to actually start a new job. I likewise, it's wonderful meeting you, becoming friends with you, learning about this podcast. I think it's a great initiative. Super exciting content that you're putting together. And it's just really great to be a part of it. So thank you for the invitation. I'm doing great.
Yeah. So let's get down into it. Like, who is Rajat? Who is Dr. Chand? Like, what do you do? Like, radiologist meets mindfulness. What is that about? Like, who are you today? What is this? Like, what? Life is great, right?
Life is great. Life is, has to be great. It's, you got to have that perspective, even when it's not. Mindfulness is all about making it great and how to make it great. So, me in my own personal journey, starting, I guess, back in my childhood, I was exposed to some of the components of mindfulness, meditation. I would say overall, from a very superficial sense, there was no deep pull from my family to really be too embedded in the philosophy of the religion or spirituality. Just kind of make of it what we would and adopt what we want out of it and carry on to our adulthood, whatever we thought was important about it. So had a little bit of a basis of understanding of these things, mindfulness and meditation growing up, and then started taking it a little bit more seriously just through my own natural internal curiosity, wanting to know maybe a little bit more about my roots, but actually the science and the philosophy itself, just, coming of age, going through undergrad, going into science and biology and pursuing medicine, just wanting to know, what is this thing behind the mind and what it claims to be able to do in terms of not only aiding in one's spiritual progress, but actually aiding in one's health and, providing a good, sound environment internally and even externally for somebody to live in and, stay away from, potential chronic diseases. And so, it's just something that I wanted to learn more about myself and just started taking it up. Independently, I would say, halfway through my undergrad years, just thought, let me just develop a regimented practice on my own, see how long I can stick with it. And, anything you start off can be a little bit rocky, a little bit up and down. But I think luckily for me, and I think for most people, commitment is the name of the game. You stick with something long enough, especially if it's tried and true, and so many people vouch for it. It will work out for you. It's just when it becomes a natural part of your rhythm and flow, something you feel comfortable with to keep up, for however long you want. And, luckily I was able to find that rhythm and flow, and, it became a consistent daily part of my life. And, fast forward a little bit into, my residency years, really sort of faced with some of the qualms of modern day medicine, and just understanding from a personal sense of how actually this practice that I luckily adopted, not too long ago, is helping me not only understand these issues better, understanding how they affect me better, understanding how they affect my healthcare environment, my colleagues, and not only understanding the effect of the issues in medicine and modern day medicine and what they have on the environment and practitioners and providers, but understanding how to get over that, and mindfulness and meditation being a tool to really address these issues and not only heal yourself based on off of what you see and what affects you, but also be able to heal others, which is also the other part of the equation. And being able to do that in a way that really comes from a place of compassion and equanimity. And so, as I progress in my practice, I start learning how mindfulness is a tool to really not only be affected by the issues, but also continue to provide excellent care to patients. And so I just, it was like two, lines going parallel in the same direction, just making complete sense in terms of having to keep up the practice to be able to continue to thrive in such an environment. And then, becoming more progressed and I guess more skilled along those lines, and becoming more knowledgeable in terms of looking into the science more and actually understanding, what is it about mindfulness? What is it about meditation that affects us? What changes happen in our body, in our brains, in our minds that really allow us to adapt in such a way and be able to thrive. And then it just became from there, a natural inquiry, curiosity turned into a passion, into a hobby, wanting to not only just keep this information or what I saw as a secret to myself, but be able to spread that message to others and, say, hey, there's a way to, live beyond the stress, live beyond the burnout. And not only that, but provide excellent care along the way, to my colleagues, to anyone I came across, and even to my patients, because our patients are dealing with the same issues, not only affected by the healthcare system due to a number of different reasons, rising costs, inadequacies in access to healthcare. I mean, you name it, there's a laundry list of items. But also, finding compassion in themselves, something that's really important for one's health, and being able to avoid, certain disease processes. And so, I saw it as a multifaceted tool to help not only, fellow providers, but also patients. A curiosity, hobby turned into a passion, desire to educate as many people as possible. And that's what I would say has landed me here today. Somebody who's just written a recent book that talks about the subject, and is sort of an A to Z manual handbook that serves for anyone in healthcare, really, not really for patients, but mostly for the provider side, to be able to learn about mindfulness meditation sort of as a blueprint in terms of what it is, how to integrate it into your personal lives, into your professional lives, into your healthcare environment, whether that may be a clinic, an office, medical education, administration side of things, whatever it may be, and to maintain the practice and to and all the aforementioned benefits that come through that. So that's the long and the short of it. I'm happy to sort of iron out anything in between, but what
there's so much in there. I've got all of my notes written down from just that. Like, so cool. We're definitely going to get to your book because I think you talked about parallels, right? Like, it's a parallel to like what I call and like it's funny how you meet, right? Like, you're doing what you're doing for your profession, like this healthcare profession. We got to talk about stress and burnout in healthcare. We got to talk about the backed by science piece because we're both scientists, right? We both learned from the language of medicine or West medicine, right? MD, pharmacist, and we've had our own health journeys, right? These journeys of healing ourselves and being called to help others, and the parallel of using it. I loved how you said, like, using it in your day-to-day, not only for yourself, but to teach your patients, to teach the healthcare system that's broken. It's obviously broken. We know that it's broken. We're the sickest, richest country in the world. So there's so much to unpack here. So I'll try to guide some of these questions because they're all amazing in this parallel universe we're both in. Is like, I'm literally in a process right now of running pharmacists through a burnout reversal program. And it's all based on mindfulness, right? It's based on, like, we can talk about the science of like heart math and neuroscience and moving the brain waves and how it relates not only to our own personal well-being, but it also, we even in the energetic field, like, it's like it translates over to your patient. It translates over into them. And so talk to them, I love what you're doing, but was it always this way for you? Like, what was this? Tell us a little bit about, take us back to this time where, because when I think of healthcare, like, it is super stressful, and you're an MD, you went through undergrad, you went through medical school, you went through your residency, you've gone through all these processes, and it's super stressful. In other words, it's almost like a rite of passage, right? Tell the people listening, like, what was it like going through that process of, like, you'll sleep when you're dead philosophy of, like, if you don't work 120 hours, you're failing per week. And that's, I might be undervaluing that a little bit or underestimating. So take us back to where you went through school. Did you always use this mindfulness? Were you already like there? Or was it there a place where you're like, something else has to click here?
Yeah. So
there's no wrong answers to these questions. That's why they're beautiful.
Yeah. No, they're great questions. So again, I think my own independent mindfulness meditation practice just luckily started alongside my my education. There was no sort of point where, like, I need to pursue mindfulness meditation in order to help me get over the qualms that I'm experiencing in education and in modern day, Western medicine. It's just luckily something that I started early on, and luckily that I adapted into my life in terms of a continuous, ongoing daily regimen, and then found that wow, this tool that I just luckily adopted, I would say in the thick of my residency years, is something that is really helping me face these issues that I'm experiencing that I don't really align with, that are bothering me in the sense of, medicine being a profit driven model, that there's so much greed and power struggles. There's a wonderful quote by Paul Starr. He's an author. He's a professor of sociology at Princeton. And he says, the dream of reason never took power into account. And I think that's so applicable to medicine and kind of the problems that we're facing in medicine. It's an institution that should be based off of reason and interconnectedness and lack of greed, but it's just so usurped and consumed by those issues. And a lot of it comes down to, just aforementioned greed, the need for power. So, experiencing these things, face to face in my medical training, and then just realizing, wow, like this tool that I've adapted is really helping me kind of understand myself and others through this process. But not only that, overcome it as well and progress, from a personal and even spiritual perspective. And it's funny. It's one of those things. And it's like, there's a good and bad in everything from a non-dualistic approach. It's like, gosh, I really had to be in the thick of the struggles of a really harsh environment in terms of training. But it's those types of environments, especially when you're able to keep up a practice like this, that will really even, allow your progress to take off from an exponential, manner. Being able to practice mindfulness and meditation in not the best of circumstances gives you that much more ability to progress in terms of being able to acquire its benefits and even advance spiritually. So I think I was lucky, but, obviously it's one of those things that you look back on it. Do you wish you could have avoided it? It's hard to say because I wouldn't be here where I am right now if I didn't have, the training and the circumstances that I went through. And so, to I guess, go back to your question, were things always this way? They started as separate entities, kind of moving alongside one another. And then it came to a realization that this is something that's actually going to help me drastically, not only through my training, but in my personal life. And ultimately when I'm practicing, autonomously as a physician, to provide really holistic healthcare to my patients. And I think our patients know the difference. I think our patients, when they meet a provider, compassion and the ability and just your general interest in their care from the view perspective of interconnectedness, seeing someone as you see yourself and not just as something that's going to add value to your practice or something that's just going to, help you from a material perspective. That's something that people, I think, pick off right away.
And I think it's really important. What you said earlier just now was also really important. I want to touch on this because what we're talking about right now is what I think you believe is like this new present future of medicine, right? But we have a big challenge issue. Our healthcare system is broken, and the fact that it's broken is because it is profit centered, right? We know big pharma, we know big business, we know big insurance. Healthcare in this country is a business first. This is why I started my own pharmacy, which turned into a wellness center. Like all doctors and pharmacists and healthcare providers, that's the first question I ask a pharmacy student that comes to learn from us here is, why did you get into pharmacy? And they say, I want to help people, right? So we all want to be healers, but then we get trained, right, as doctors and pharmacists in this Westworld medicine of allopathic disease, diagnosis, treatment. And then what are we taught? Like, we find out your problem, which is not patient-centered. We prescribe you a drug and put you in the system, and we hope that, and we tell you the drug is supposed to fix you or heal you. But in fact, for chronic conditions, we all know that just masks the symptom of the problem. We didn't really, and it's funny in the drug monographs, because in pharmacy school, I'm dated. I did it pharmacy school in the 90s, is you'd pull out the package insert and the very top of it would be, in conjunction with diet and lifestyle changes, take this medicine. But we kind of skip over that. And so you and I are talking about bringing these mindfulness practices into ourselves. I love what you talked about. I call it the merging, right? The merging of your parallel world of, hey, I'm doing this for me, but it's actually really good here and it just fit nicely. So we got to talk about this, because this wasn't the case for, like, you didn't learn this in medical school. Like, you should treat yourself first and you should go within and close your eyes and be mindful. Like, so let's talk about, because what you do, right? You want to teach future generations of physicians, and you happen to go along this journey. And now we're figuring out the science, which is our Westworld brain. Our scientific brains need to say, this has to match the thing, right? We talked about before this conversation, like, there's lots of peer-reviewed journals and studies now with mindfulness and neuroscience and neuroplasticity and how it affects the body, and how this body-mind connection is a real thing, not a woo-woo shaman's been doing this. So, this podcast is about ancient wisdom meets modern science for true healing. So, one, we got to talk about that. But before we talk about that, I want you to talk from your own perspective, the issues we're having in healthcare today as it relates to the stress and burnout and emotional well-being issues we have in healthcare as it relates to providers. Like, yeah, because when you went through med school, I'm pretty sure it wasn't the easiest experience of your life, and all the students that you saw, but then you become a doctor and you're already, like, tell people about not only what mindfulness does, but before that, let's talk about stress, burnout as it relates to being a physician, and the continued, I call it the feed forward cycle, because the 6-minute visit and the profit first and all this stuff, we're bringing all that on. And so healthcare is a super stress. How do the brokenness for me, we're in one of the most stressful positions of any provider or healthcare, or not even healthcare, of any profession, but we're supposed to be the people helping people get well.
Yeah.
Well, let's talk about the problem, and then let's talk about that solution, because I think we're on the same wavelength on the solution part.
Right. Gosh. Okay. So it's like,
I want people to know, like, from the doctor perspective, like, what's the normal day look like, and how is that? How does that work from the? It's just why is it broken for you?
Yeah, I think it goes back to these sort of main core issues that we've talked about: greed, profit-driven model, power struggle, hierarchy, this lack of interconnectedness, just seeing something, and this just material sort of acquiring attainment perspective of training and
walk
job.
And that though, walk the person who's listening or watching this, like, walk us through the life of how we're actually, as providers, because we all doctors, pharmacists, healthcare providers, they want to do well. They really want to take care of people.
Absolutely.
But there's so many roadblocks for us.
Totally. And I think it goes back to this whole dream of reason forgot to take power into account, and the way that we define power and the way that we define it is having and money and hierarchy and separating yourself from someone else based off of just how much you've accomplished or what your titles are, or these types of things. So this whole dream of wanting to do well and help others, it's there. It's very real, as you mentioned. That's the most common reason that people go into this profession, is they want to be compassionate providers. But all these issues that we've talked about do an injustice to the system and essentially set people up for failure, because the reality of the situation is that when you go through all this training, you go through all this education, you land on the other side, you get your first job, you're immediately, sooner than later, you're immediately faced with the reality of the situation is that, all right, there are outcomes. There are, you have to be not only a very responsible, very, intelligent and capable physician, but at the same time, while providing excellent care, you have to meet demands, and you have to make sure that, wherever your work environment is, whatever your revenue model is, that it's thriving and that you're an equal player. And for many individuals, that can end up meaning taking on a significant amount of work that maybe you thought, in all the glory of your profession and providing compassionate care and kind of what that does for your ethos, that you thought you could take that on and you could do it day to day. But the reality of the situation is that it's impossible. It's really, really difficult for individuals in this type of environment to meet those types of demands. And at the same time, by the way, live out this lifestyle and to a level of comfort that they thought that they would be able to acquire and maintain. And it's just sort of this sort of vicious revolving cycle of this, having this perspective of acquiring, this material perspective of making money for the organization, but also acquiring the next thing and just acquiring more in life. And, once you are able to meet the mark and, make the CEOs happy, then, it's just about making sure that you make enough at the end of the day to make sure that your life is comfortable. And you're always sort of just seeking comfort on a level that's defined by, materialism and material needs and desires. And you just consistently want more and more and more of that. And you're always just chasing the same things over again. All right, meeting adequacy marks, meeting productivity levels. Okay, making enough of a paycheck to have the things in life that I want. The process and how medicine is structured sets us up to be that way. It creates our minds to be concerned about only these things. And it doesn't matter who you are and what you do. When you saturate the mind and our egos and our self-referential thinking process with these main things that matter most importantly in life, you're constantly just going to be, worrying about those things. And then slowly, as you're acquiring more and more, as you're meeting these marks, the stress and the burnout, which is, directly related to these things in your mind and other things you have to worry in your mind, whatever it may be, the education that you're providing or the lack of education that you're providing, your health outcomes, how good they are, how bad they are, how well your patients are doing, their long-term outcomes, your interactions with people at work, not only at work, in your personal life, in your family, how those things are being, effective. All these things are contributing to basically the stress of the mind, which then basically, as you and I are well aware, translates to the stress of the body. And so, that's, I guess, the long and the short of it is, it's a system. It's unfortunately, it's an issue that's created by and perpetuated by the system and how the system is created and run. We are just, unfortunately blind to the process as it's occurring. We think that we're meeting the mark and we think that we're acquiring so that we think things are great, but slowly, incrementally, the stress is building up, the burnout's building up, until we maybe get to a breaking point where we don't understand why things aren't going the way that they should, or why am I having, chronic stress, whatever it may be, obesity, insulin resistance, substance abuse, all these things that we use as, the way our body reacts to all this, or the way that we may try to escape these types of, issues.
Which is a huge piece, right? Totally. Yeah. Because what you said, there's two things. Like, the system is stacked against us because we go to these large institutions. There's a high amount of education needed to be a provider these days. Pharmacists and doctors, they're doctors. They go through this doctorate program, and then they got to get the skill set. And so you spent this big, huge period of time because you really feel like you want to help other people. You have a ton of debt. And the reward at the end of the tunnel is, well, you can make a good living and you can do what you want to do, what you love to do. And then you get in the system. I've met plenty of doctors and now pharmacists are trying to get out of the system because the system's failed them. Because once they get in it, it's like now they're in the rat race. So they have to cover their debt and they're not actually able to do what they thought they were supposed to do, which is help people, right? And so this is feed forward system, but then it creates that perpetuating stress with the downstream effects of stress as insulin resistance and obesity. And then what you said is like numbing the stress with the things on the outside that aren't so good for us. And then we get substance abuse, and burnout is real. So thank you for bringing that up. Like, healthcare burnout, like, people don't realize suicidal ideation for healthcare providers is at the top of the list. So we know there's a problem. We know it's so the reason you are so called to do this as a provider for providers, mindfulness. Talk to us a little bit about the science from your perspective, because I want people to realize we can say this stuff as we've already been through it, but you're seeing a ton of physicians and you work in a hospital system and you're a radiologist and you've got all these different people in the system, and they're not all like you, right? They're all pretty much burnt out and on the end of both. They're burning the candle on both ends. They're super stressed out, and we can help them. But talk to us a little bit about the solution here, like mindfulness to you, meditation. What has it done for you? And then what do you think? What is the science here? Like, tell us a little bit from your perspective, because this will obviously flow into what we're doing here. But tell us a little bit about that, because I think it's important for people to hear it from the doctor who understands, medical terminology, but also this is stuff that people have been doing for thousands of years, right? So talk to me about the science. I love the science of this stuff. We're bringing the ancient wisdom into the science piece now.
Yeah. It's all pretty straightforward, I would say. Looking back at this model physician that we have who wants to do great, who wants to provide compassionate care, and then ultimately gets trapped in this model that doesn't do justice to their aspirations, who they really want to be as a physician. Not only does this person have to live and work in this model, they have to do what they set out to do. They have to be that compassionate physician day in and day out. They have to make lots of sacrifices to be that person, whatever it may be, waking up early, limiting their involvement in outings or vacations or whatever, just trying to be disciplined in that aspect, but also trying to be disciplined in being a compassionate provider. And those two things are really hard to do. They're especially in the environment that healthcare providers have to work in, being compassionate and making sacrifices are just adding to the pressures on a certain individual. So it's not easy. It's not easy to provide compassionate care day in and day out. So you basically look at this model where somebody's trying to balance these two things that make them a wonderful, not only person, but physician. And then you look at the time in between. in the time in between when they're not working and they have this time off and they want to be, they want to relieve themselves, what is the main issue that's not letting them be someone who's mindful or present or finding joy in their everyday circumstances? And it's what we've already talked about. It's the stress. It's the mind. It's this thing in our mind that continuously makes us think about ourselves. And in this environment where we're facing really hard work, we have to provide excellent care. We have to be cognizant of our outcomes. We have to reduce our risk and responsibility. We have to train other people. We have to do that in an excellent way as well. Oh, but also I have to make sure that the business is running, and, I have to make sure that I'm making enough money at the end of the day to live comfortably. Our mind has no other possible way to escape these components that are just basically the things that saturate us and that we're going to constantly think about because it brings us back to us and our survival in this world and our perception of living as a thriving individual. And so the whole science behind it is basically breaking that cycle of thinking about me and my issues and the problems that I have. And instead of being consumed by anxiety and fear in the time that I have off, you're able to actually live in a way and experience the world with more joy, self-compassion, appreciation for your everyday circumstances and everything you experience. And then that's the puzzle. So it's like, how do you make that happen? It's how do I not pay attention to my problems? How do I not pay attention to these things that are really important that affect me daily in my work and my personal life? All of the anxieties and the fears that we accumulate that we're constantly thinking of. And it's basically breaking this self-referential process in our mind. And there are a number of different networks in our brain that contribute to this self-referential process. But the main one is called the default mode network.
Yep.
And you probably heard about it. And there are a number of different networks in the brain. There's the salience network. There's the central executive network. But basically, the default mode network is the brain's way of basically continuously thinking about itself. And what we're able to do through meditation training is we're able to weaken the connectivity of that network in the brain. And we're able to amplify and strengthen connectivity of the other networks and the communication between the frontal lobe and namely the limbic system, which, controls things like our memories, our fears, things that are more associated with our mammalian or more primitive brain and that allowed us to survive in our more primitive environments. And when you strengthen certain connections and you weaken other ones, basically what you're allowing your brain to do is create a new type of connection between, or you're trying to modify the connection between the frontal lobe and the limbic system so that you are able to not give your attention or pay so much time towards this self-referential thought process, which is, the default mode network. And so that I would say is, in a nutshell, what we're trying to do. We're trying to lessen the control of the default mode network, and we're trying to increase the strength in the activity and connections between other networks that allow the frontal lobe and the limbic system to communicate in a way that's new for us, that we haven't really had the opportunity to experience before. And then when you're able to do that, you're able to basically enter a zone where there's just less thought. There's just less thinking overall. And as mentioned, the thinking about me or I-ness or, what is going to help me in my survival as this related to my fears or anxieties. And so a lot of the growth that comes through meditation and mindfulness comes in that space of clear, essentially nothingness.
What you call quiet the mind, right?
Right, exactly. This quiet zone where you're able to notice new things that you normally wouldn't notice, either within yourself or in your environment, and develop new appreciation for these types of things. Where in your normal day to day, you don't give yourself that opportunity to even realize that there is a space like that could potentially exist. So yeah, it boils down to, I would say, these new connections, this communication between the frontal lobe and the limbic system kind of boils down to a few major things. One is attentional control. So deciding where we're going to give our attention, how much of our attention we're going to give it. And the other thing is emotional regulation. Deciding what our response is going to be to the things that we experience and how much of an emotional response or what type of emotional response we want to give to that experience. And it could be anything from pain or fear or anxiety. And then when you come to this clear space of being able to evaluate things with less thought, you're able to train your mind in a way to say, you know what, I don't need to be as reactive to this thing that I normally have given, X amount of my fear or anxiety response to. I don't need to even appreciate pain, even physical pain, in a certain way, compared to how I normally would have in the past. And you sort of, your brain sort of teaches your mind and your body of a new way of living and experiencing and reacting to basically everything around you, not only around you, but within you. So that's what I would say, without, getting too much into the different sort of anatomical components, just keeping it kind of basic at the networks, understanding the connection between the frontal lobe and the limbic system, and then realizing that the two major players that we're trying to modify are our attention and the control of our attention, and the emotions and the regulation of our emotions, and which includes actual physical response to pain.
Yeah, I firmly believe that. Like, a lot of the way I say this stuff too is like the limbic system is like the older brain. It's the mammalian brain. It's the fight, fight, or freeze. It's there for a purpose, right? We can't survive without that part, but we've survived because, we can run from the tiger. We don't get eaten. We go back to grazing, right? Well, all mammals can get themselves out of that there's no default for them to stay in fight or flight. They don't get eaten. They literally shake off the energy and they go back to their thing like nothing happened. But we have this thing called this nice, beautiful, front brain, this neocortex, this frontal lobe, like all this creative space. And what you're either in fight or flight or you're in rest and digest, right? Sympathetic, parasympathetic. You can't be in both. And so I try to teach people, like, if you're in fight or flight, you can't be creative. You can't be in your zone. You can't do the things your beautiful human, like, evolved brain can do, because you're still in that limbic, I'm still fighting, I'm still freezing, I'm still here. And so I love what you kind of paralleled the default mode, because people get defaulted into that mode. In other words, people are in fight or flight 70% of the time, but we're not humanly evolved to do that. So how do we get out of the default and circle that flywheel backwards? Is through meditation, is creating those new neural networks and allowing us to create a new default, if you will, which is more in line with where we're supposed to be, right? So I loved all of that. That's beautiful. All right, let's talk about your book, let's talk about like bringing providers to this place where we're moving them from survival to creation. We're moving them from this state of stress and burnout into this place where they, no matter what the stressor is, their perception, like I love what you said, is like, it's not just the awareness and where you put your awareness, it's also the emotional gravity to what you put to it, or how long you extend that out, because we're all stressed. We're still in this environment, right? As healthcare providers and in the world, for Christ's sake, like everybody's stressed. So talk to us a little bit about your book. What was the inspiration? And like, cause I love this concept that you're bringing it's like you said, it's not new, but it's so needed. Like if we could get mindfulness in medicine, I have this vision of having meditation classes in my pharmacy, like after hours, bringing people in and teaching them that this is it, and teaching providers. Like we've already chatted about how when it's not if, it's when the retreat for all of this is going to happen for providers. But talk to us a little bit about your book, the inspiration from it. Cause you're a well-seasoned author now, and you're integrating all this, and you're now it's about the future generations, right? And getting people now. So talk to us a little bit about your book.
Yeah, the book, as you hit on,
Mindfulness in medicine, right?
Mindfulness in medicine, yes.
Cool. Yeah.
Right. Mindfulness in medicine. As you've hit on, we're not trying to reinvent the wheel here. We're packaging old, well respected and validated from a current scientific perspective, science into healthcare in all different spaces and whatever that may look like, whether it's for the individual physician who just wants to make it, or provider who wants to make it more a part of their own personal lives, whether it's a clinic, a medical department, medical education, a blueprint for anyone in healthcare who wants to find this way out from this cycle that's not getting them the wellness results that they want, or is not allowing them to be the holistic type of practitioner that they want to be. And a handbook that, defines what it is, the basic science of how it works. It includes multiple recent publications that support all of this stuff along the way, there's also some appendices in the back that serve as an anecdotal guide for producing research. We found some really good recent articles that have been published, and it got a couple of the authors to agree to put in their experience in terms of putting together a study in mindfulness in the healthcare space and kind of how they went about doing that. So for anyone who's interested in producing research, that could be a very valuable guide to just glean some practical information from those authors in terms of how they went about it. There's also, in terms of medical education and training, for anyone that's interested in making this potentially a more part of their training program, kind of what that would look like, how they could go about it, how to facilitate, access to and even structure a training program for both the teacher and the students. And even at a more far-reaching perspective of what this would actually look like if it were integrated into medical education and graduate medical education training. What the ACGME milestones would look like if they were adapted to include mindfulness as a measure in terms of a proficient doctor who's ready to go out in the world and provide compassionate. So it touches on, obviously there's a lot that we could have written and expanded about, but it touches on some of the more general aspects of healthcare as you would expect to be touched upon, and how to integrate mindfulness into all of them. And that's mostly what the book is about. What was your other question following?
No, it's a big thing, because here's the deal. Like mindfulness, meditation, the research is irrefutable now. Like we know it's so important for immune function and pain and everything, because it really does connect the mind and the body together. And so, in fact, I've recently got privy to a new peer-reviewed study that shows that like 60 health conditions can be improved within 1 week with mindfulness. And so we know that this works. And then I love how you're like moving it to how does it relate to me? Right? So this is a handbook for medical providers in any part of healthcare that not only can help themselves, but also help their practices move in that direction, right? So it's not just if mindfulness works, it's we know it works. And now how do we integrate it directly into the practice of your specific modality, right? That's awesome. I love that. The second piece was you referred to it like, well, and we've painted the picture of the future. Like because I know you're really passionate about this because it's who you are now. It's like you want to teach future generations. So how do we get these in the medical schools as part of the curriculum? How do we get these into the pharmacy schools where we're getting people there? So I love how you've touched on the science. You've touched on the practical aspects of doing it, how to actually get done. Because I think a lot of people think, every first thing they say is like, I don't meditate because I'm not good at it. It's like there's no such thing as not good at meditation. If you can close your eyes and go within, you're pretty good, right? So we know that. So there's this part where you get them through that process, and I love that. And then you move it into the medic. So there's this side, it's like that fusion again. We talked about it, like moving it now into the profession. But I always love this piece because in healthcare, or what I call sick care now, but in healthcare, when we're trying to make people less sick, we don't have to really do what we teach in that space. But in well care, you really have to do you first, right? You have to be a product of your product. And so this teaches you how to meditate. So this is why you do you, but then you help others through your own process too. So it's not just, well, how do I bring mindfulness into medicine? It's you're patient number one, right? So I love that part. And it makes great sense. And every single healthcare provider that wants to do wellness or well care or healing or, that is the big shift that I've always seen everyone. It's like, you can't just prescribe it for someone else. You got to live your own life there. So
yeah, exactly. And I'll just tie it together, based off of what you said. And this really touches on the medical education and training side of things and what that actually looks like in terms of implementing mindfulness into medical education and training. It's not only is it learning it for yourself and figuring out how you're going to make this part of your personal life, your personal schedule, so that you are able to become a more mindful provider. But what the book talks about and how it sort of ties it all together in terms of being truly a holistic provider, what you have to do is help your patients and teach your patients how to be mindful as well. So it's one of these curiosities and sort of paradoxes that I've always viewed in medicine is that we teach the breath and respiration as a vital sign, and we measure it, and there's multiple different ways to measure it and get a good understanding of someone's physiology based off of their respiratory pattern and how much they're breathing. But we don't teach at a very basic level the how to breathe. And that's really what mindfulness is at its core. It's teaching how to breathe. So if you read the book, a core component of bringing it into your healthcare space, whatever that may be, your personal space, your clinic, your department, your medical education place. Yes, you've touched on it. It's learning how to do it yourself and learning how to do the practice autonomously and do it from a committed perspective, day in and day out, because that's really where you get the most bang for your buck in terms of growth and all this. Not only doing that, but doing it for your patients and teaching your patients how to potentially get ahead of a lot of, all these psychosomatic, problems that we're seeing out there where stress is the major player at the end of the day, and being able to control and slow down the mind and have less stress, and what that looks like practically in a patient interaction and how you would go about doing that. And it's really simple. It's you block off a little bit of time that you have, maybe as you greet the patient or as you auscultate their lungs, maybe before or afterwards, or if you see them on a telemedicine visit, or even as they're leaving your clinic or the bedside or on the way out the door, there's always a little bit of time that you can grasp and implement mindfulness teaching. And it's, the most simple of things, just putting someone in tune to their breath, understanding, the different components of the breath, understanding how to measure it, and just advocating to potentially make that a daily part of their lives. And there may be many different types of reception to this type of teaching out there. So it's not something that, we're trying to impose or give a message that it should be imposed on anyone. But I think the fact of the matter is, and this is just my personal opinion, is that, for something as simple as it is, that, doesn't really require a complex discussion or even teaching, it may be well received by a good number of patients. Something that's just giving them the opportunity to become less stressed, more calm. And hey, by the way, this may help long term in some chronic, health conditions. Attaching that message into your checkups, wellness visits, whatever it may be, just as making it a standard part of your care, can go a long way.
I love that because it's beautiful. Because I just had this vision of because you talked about why not just incorporate this into how we're trained as physicians, because we've learned it. That science is irrefutable, which means it should be put into the curriculum because the science is now supporting all the things we want to support in a scientific-based curriculum. So I just had this vision of when you're oscillating, you've got the stethoscope and you're watching their breath, but you're actually teaching them at the same time, how to breathe and how to be mindful, because that's what we do, right? What can we do in this new paradigm of health coming of the things we're already doing, right? We can incorporate it into the 6-minute visit. Even if we had to, we could, right? It's not something extra to do. And I love that piece. So thank you for kind of putting that into my own mindset. I too believe like this is something we can be doing. Is like, for me, it's like, oh, the patient comes in for a blood pressure medicine or a anxiety medicine or anything. It's like, hey, did you know that I could change your blood pressure by 10 points on systolic if I just teach you how to breathe a little bit different? Because you're already breathing, right? So you might as well just, if you breathe a little bit. I love James Nestor's book, Breath. It's a great, great book. So mindfulness in medicine, how do people get that book? If a provider or someone that knows a provider that this is like, you gotta get this. How do people get your book? How do they get in front of that?
Yeah. Just mindfulness in medicine, searching it up. It's released through Springer Nature. So, mindfulness in medicine, Springer Nature, it'll be probably the first hit that you see, online, and available as an ebook, but also in print. It's also just one of those things that will help the provider patient relationship. It's just, something that you both potentially are building upon, in your personal lives, and something to talk about in terms of progress and kind of where it's taking you and how you notice a change, in your health or just overall perspective of things, and something to bring you closer to your patients at the end of the day, and even your colleagues. Like, it could become a potential, team building practice, something, you can identify a mindfulness champion in your practice or your clinic or organization that can help spearhead some of these efforts and really bring the team together, and foster the sense of interconnectedness and really develop the community at your workplace. Just beyond the positive health effects, it's really a way to, I think, bring you closer socially, in a more comfortable way, not only with your patients but with your colleagues.
Yeah, I love it, because the science is irrefutable. It's not if we should do this anymore. Like, I feel mindfulness, my own meditation practice, learning Dr. Joe Dispenza's stuff is all like in the place for me. Like, it was the game changer in my own evolution personally and my own spiritual journey, but also like literally my own health journey. And I think incorporating this as practitioners is paramount to the success we have in this world. Because we all know like 80+% of patients that see a doctor are rooted around the one word stress. So how do you get to that is you get in front of it. But what do you do now? So what about people? Like just generalized people. You have patients, you see them, you talk to them about this. What are some steps that you could give these listeners on this podcast here? Because most people here, they're listening to this. They kind of want to go beyond the pills, right? That's the thing here, right? So what do you tell your patients if they're like, yeah, I'm kind of interested. What do I do? Like, do you have like first steps for people, places where they can go?
Yeah, absolutely. I think with most things, there should be, I think maybe we've already covered this step, or we're getting to the person who's already covered the step. There should be a natural sort of want or desire, inclination to either make a change or to experience, the world or life or their health in a different way. And I think, once you've accepted that this is something that you want to try and you want to implement into your life, the next major hurdle is commitment. And I think that's maybe some of the trap that we fall into with, current other wellness practices out there. There's a number of different things that, people can do in the aim of wellness. But as you said, the science is irrefutable. I don't think many other wellness practices have the type of science and publications to speak for it that meditation and mindfulness does. The reason that it's, so powerful is because it's something that you do every day, and you train your mind and body to be a different way, based off of a regimented approach. So, I would say that acceptance is the first hurdle. Commitment is the next hurdle. And it's something that you really want to, get the most out of it, that you have to practice every day, and you have to be prepared to practice every day. Not just one of those things where you kind of say, okay, I'm having a bad day and I kind of want to be more stressful. I'm just going to do a little bit of a meditation practice.
As it's not a pill. It's not a pill for stress, right?
Right. Exactly. And so, so I would say once you get into the commitment, then it's just, learning the steps and, start basic as you do with anything else. Guided meditations, I think, are probably the best way to go initially. That's how I started doing it. And start small. From a commitment aspect, as you can imagine with other things, like, even physical exercise, like, you don't just go in there and just kind of hit it as hard as you can if you've never exercised before and expect to maintain that as much as possible. Start with maybe 5 minutes once a day. Do a guided meditation when you're ready for it, or if you think you can handle twice a day, just do twice a day. And then as you increase the length of the guidance, I like the Mindfulness app a lot. I think it's kind of like a very just routine, general guidance that touches on all the things that you need to learn to be able to do it on your own. And once you're ready for it, do twice a day. I would say after maybe a couple of weeks or months, you can increase the length. So instead of doing 5 minutes twice a day, maybe you can do 10 or 15 minutes twice a day. Keep that up for as long as you can. If you feel comfortable, keep it there. If you think you're ready for more at some point, try half an hour, try maybe even an hour if you can do that. Practically speaking, it's not really possible for people to fit that into their life, or to really identify how they can modify their schedule to fit that in. But what we do know about the science is that the longer you do it, the more time you accrue. Intuitively, that's where you see more results and you see more changes, not only in the brain, but, personally and socially. And so, aim for higher. And then what happens is after doing guided meditations for months and months, and maybe even, up to a year or something, you sort of just learn the steps and you learn the process. And it's like, okay, now I know what they're asking me to do. Okay, now I know what I'm supposed to be doing next. Now I know how I'm supposed to be paying attention to my environment, anything I experience. Now I know kind of how to pay attention to what I'm experiencing within myself. And, oh, by the way, how to keep my breath as an anchor throughout the whole process, how to return to it. You just sort of, you figure out the name of the game and the different steps involved. And then you can get rid of the guidance and you can sort of do without the guidance. And I think that should be a goal that you should maybe strive to, is just to be able to do it in any circumstance in a comfortable place where you can find seating. You don't necessarily have to have a device with you to help you. And yeah, just, the rest will take care of itself. It's like, one of these sayings that I like is, you speak the truth, you follow the truth, and then the rest will take care of itself. Your body will learn how to do it. You may end up wanting to do it more. You may appreciate it more. You may start noticing the benefits, and that may, push you to keep doing it and keep it up. But it's about getting to that level, I think, and putting up with a commitment until you can become more sort of autopilot with all of this stuff. And then, you talk about sort of, what you're getting out of it at the end of the day. And I don't really like this this idea of like acquiring something, or there being this goal, or, there being like this sort of thing you're trying to achieve. But, for all different types of people and all different levels of practice, there are many different benefits that one can experience. And, you talk about this state of Zen, or this state of just, Dr. I think Dispenza calls it super consciousness or something like that.
Yeah.
There's
Gamma.
Gamma. There's this whole different range of cumulative hours, and kind of what defines a beginner versus what defines an intermediate meditator versus what defines an expert, or somebody who is able to achieve that state of Zen or Gamma or super consciousness or whatever it may be. For someone like that, from my most recent understanding, you're talking about, tens of thousands of hours of cumulative, meditation. I tell people, just look at your schedule. Like, what would that take? Like, if you were to start now and you were to do 20 minutes twice a day, how long would it take you to, just do the math? Anyone can just do the math at that point. But I would say in between, there are multiple, even from day one, there are multiple benefits that you can acquire, especially with respect to decreasing your stress. Yeah, especially with respect to living more joyously, more harmoniously, extracting the everything positive from the present moment and carrying that into your professional life, and even being able to deliver that message to your patients and teaching them how to do it. All of that stuff is I would say stuff that comes early on, beyond a certain level of commitment, because I think it goes back to this major point of having to do it yourself and becoming adept at it yourself, and being able, comfortable enough to know kind of what you're talking about and know how to teach it as well.
Yeah, it's amazing because yes. So you don't have to be a guru. You don't have to sit there for 10 hours a day doing this and being peaceful under the Bodhi tree, right? But what you can do is start by starting. Like 5 minutes a day is all you need to do to start. Now, does it get you enlightenment at 5 minutes a day? No, but it starts, right? I use Aura Ring. It tracks heart rate variability. It allows me to see the momentum. Aura Ring also is a great example. Like, get a guided meditation, right? It's not easy to just do this yourself at first. So I always say the easiest places to get this done is before you get out of bed, or like right when you wake up, before you start your day and the whirlwind hits you, and before you go to bed. Those are two nice bookends that you can separate a few minutes out, right? And I always say 5 minutes is good. 10 minutes is better. 15 is great. Once a day is good. Twice a day is better. 3 times a day is great. That gets people to start. Like, because anybody can do anything for less than an hour a day. We can just find it, right? So I love that you kind of just brought that in, is like, you don't, and then you build over time, those coherence, that default becomes different over time, because it's like the bank account, right? You don't become a millionaire overnight. You got to put in money slowly, and you got to build the bank account. Well, this is like building the coherence bank account. This is getting that into that place. So you hit all the buttons that I love to hit with that. So cool. Mindfulness in medicine. My new friend, this is amazing. I'm so glad that you were able to do this. I know that we're going to be doing some fun stuff together, because I feel like we're in this place and in this time for the right reasons. Let's get in front of this in medicine, because this is where true change does happen. And thank you so much for doing what you do, being so passionate about it too, because you are a super busy physician. And you're still doing this, and you already exude what it looks like, right? You're chill. You're just relaxed. I could see you in practice like this. Who doesn't want to go to a physician like that, right? Amazing, my friend. Thank you so much. This was awesome.
I appreciate that. No, I think it was wonderful. You mentioned heart rate variability. So I just have to say one time of heart rate variability. I am a total advocate for in the morning and in the evenings, but a large part of what we're doing with meditation and mindfulness is teaching our parasympathetic nervous system to communicate with our sympathetic nervous system and how to do that in a way that is in more harmony with our body. And sometimes implementing a meditation practice after something that stimulates you from a sympathetic nervous system perspective, in the least opportune of circumstances, really sort of telling your mind that, even though this may not seem comfortable, you may not want to try it. There's a lot of benefits to be gained out of meditation, even when it may not seem like it's the most comfortable thing to do at the time. That's the last little plug I'll make.
No, I love that because that's also the piece is like, it's not when you're the most calm. I just like that to get him going. Like the middle of the day one is great. It's like, because you can actually go from a depletion state to a renewal state in a short period of time. So thank you for actually adding that, because that's exactly, it's not this or that. It's like, get the reps in, build the bank account, and at the same time, you can do this stuff in the moment. Right? It's nature's Xanax, right? You can do it at the moment. You can chill yourself out in 5 minutes or less. I also do this too. This is cool. Maybe this is why we're supposed to continue, right? Is every 3 hours, 3 minutes. I put it on my phone. It's focusing your breath for 3 minutes every 3 hours in your workday. Anybody can do that, right? And it's one pause. No matter where you're at, you can do that. And so these are really good tips and tricks and hacks for anybody, but especially so in between office visits, right? In between patients, you're not going to be doing it, maybe not at first in the visit, but in between visits, you have a little bit of time where you can just put a little bookend on it. You don't have to go into Zen mode. You could literally just do it in the moment, right? Because that's a really good learn. Imagine getting reset before you go to the next patient when you're triggered, right?
Right. And I guess one of the most important things is what you learn is carrying that mindset into your wakeful moments where you're actually doing work or interacting with somebody, learning how to entrain the breath in those moments. And how it creates that space that we talked about to experience those moments differently. I guess that's the whole idea of all of this. And so, I feel like, we could continue talking about this for hours, but it's been really, really wonderful. Thank you for giving me the opportunity. And, we should maybe do it again sometime or keep the conversation going.
Can't wait to meet you in person, my friend. This was awesome. Thank you, guys. Everybody, stay well.
Thank you.
Thanks for joining me today on Beyond the Pills. If our mission to de-prescribe 10 million unnecessary medications resonates with you, share this episode, subscribe, and leave a review. Whether you're a practitioner or someone ready to reclaim your health, visit rx2wellness.com for free resources to begin your journey. Together, let's go beyond the pills and co-create a world of vibrant health and true healing. Until next time, live better and stay well.